Welcome to Deuk Spine Institute's live stream spine surgery. It is September 16, 2025. Our patient travels from Ecuador to Deuk Spine for treatment. He's been having back pain now for 10 years. 10 years, 10 long years. We met over Zoom. He did the MRI review, and I figured out his back pain was coming from 3 areas. 2 discs, 1 piriformis muscle. We're going to treat all 3 today. Now, he has L4-5, L5-S1 discogenic back pain. That is the primary problem. Henry, let's show the audience the 30 different causes of lower back pain that we see all the time. I'm Dr. Deuk with the Deuk Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Deuk laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Deuk plasma rhizotomy of the SI joints offered at Deuk Spine or Deuk Joint Institute. The 4th most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Deuk piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4 and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Deuk Machen. Thanks for joining us. How bad is that? How high does it go? Is that where you get your pain? Is that where you get your pain? All right, so he is 10/10 at L4-5, and it's concordant. Is it better? How bad is that on a scale of 1 to 10?
Give us a number. What number?
How bad is that on a scale of 1 to 10? 8. All right, you can put him back to sleep. All right, folks, we've just completed the discogram at L4-5, L5-S1. And at L4-5, he was a 10 out of 10. L5-S1, he is a 8/10. Hey, stay here. We were just starting his piriformis release because he was too sleepy to do the discogram. So we decided we'd do the piriformis release while he was waking up. But we're going to go back to the piriformis release. He's getting a left piriformis release. Henry, let's show the audience, since you showed them the 30 causes of chronic back pain, show them how a piriformis muscle tear can be so painful and the best way to treat it.
Of course.
A piriformis muscle tear can cause lower back pain and sciatica. A piriformis muscle injury causes a tear, in which piriformis muscle inflammation causes back pain. And also, piriformis muscle inflammation may cause sciatic pain. The best treatment for piriformis muscle syndrome is the Deuk piriformis release. From there, the piriformis pain is permanently eliminated. The advantages with the Deuk piriformis release is that it's an outpatient procedure, which would take up to about 30 minutes. Minimal bleeding and pain after the procedure with an immediate recovery and return to work the next day, as well as a 99% success rate with permanent pain relief with a single treatment. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-BACK 349-6922.
Okay, while you guys were watching our video on, double check it later, okay?
Yeah.
On the piriformis release, we completed it on the left side. He had a lot of scar tissue, I could feel it. And when you hit the scar tissue of the inflammation, so what happens is the piriformis muscle runs from the tailbone to the hip, top of the hip called the greater trochanter. What happens is when you bend over improperly and twist, you rip the muscle. It's very easy to rip, but it's not right here, it's deep inside, and you get like an ice pick feeling right here where the AD is. So I went in with the probe and I released the muscle, and I could feel scar tissue where the muscle was attached to the top of the hip. There was a lot of scar tissue. Not the most I've ever felt, but a good amount. That means that that muscle has been injured, been inflamed. Okay, this is all the blood we've lost for the entire surgery. We've already done our discogram. We know that he's got 10 out of 10 pain, concordant at L4-5, which we knew based on the MRI. It looked pretty bad. And then L5-S1 is an 8 out of 10 concordant. So we're going to go ahead and get started with the laser surgery. And I guess we're doing 5-1 first. Shot? Any questions?
At this moment, no current questions.
So we've completed the piriformis, and I need a Raytech, and we're going to get started on the discs. The first disc we're going to do is L5-S1, which was an 8/10 concordant. Now, how do discs cause back pain? Have we shown our audience that yet?
We have not.
Let's do that.
Of course.
Disc injuries start with an annular tear. Damaged nucleus. Pulposus herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
One thing that's important to note is many surgeons would have ignored the L5-S1 disc because it doesn't look that bad. The L4-5 looks like the bad one, but L5-S1 was also injured. It was bulging, and based on where his pain was, I could tell that that 5-1 disc was causing his back pain as well as the 4-5. So most surgeons would have just treated L4-5, and what that treatment would have been was being a fusion. That would put more pressure on the L5-S1, which was already injured and painful, but didn't look that bad on the MRI. Over the next few years, it would have become more and more painful, and the patient would have to go back and get a second surgery. And they would call it adjacent segment disease. But the reality is that that problem was there already. Here we are at L5-S1 right now. Take a look at this disc. We got some inflammatory tissue. You've got the blue stuff, which is the herniation of the nucleus. It's degenerating. That's why it stains blue. And the patient will be able to understand and appreciate what I'm saying. Chronic inflammation creates scar tissue, calcification, and granulation tissue, which contains nerve fibers that are nascent, N-A-S-C-E-N-T. They are pain fibers, nerve pain fibers. And they are so easy to get aroused, to get excited. Okay, these nascent, they're called type 4 class C fibers. That's what we call pain fibers in the body. They transmit pain signals from your tissues up to your brain. So your brain is aware there's a problem somewhere in your body. For example, if you break your bone in your leg, you're having pain. You're going to have pain from certain pain-sensitive structures. It turns out not everything in our body is pain-sensitive. Many things are not pain-sensitive. Okay, so you've got to know what structures are pain-sensitive as a surgeon or a doctor, and you have to understand that if you're going to do surgery, for example, you have to numb up certain tissues. You don't have to numb up others. Many of you have seen brain surgery done on an awake patient, right? Well, the reason we can do that is because the brain itself has no pain fibers. You're able to cut the brain without the brain hurting, right? And you can actually operate on somebody who is awake talking to you while you're cutting on their brain. The reason is the brain itself has no pain fibers in the brain. Therefore, people won't feel pain as you're cutting their brain. We know this because we all watched old 80s movie, Silence of the Lambs, right? Huh? No, that was Red Dragon. You're talking about Red Dragon. That wasn't Silence of the Lambs. Wasn't that Red Dragon? Oh, that was Silence of the Lambs, the first one.
Yeah, Silence of the Lambs was the first one.
Puts the lotion on the skin, yeah.
And I think that came out in 90-something.
Oh, was it 90s? Okay.
91, yeah.
Anthony Hopkins.
Great film.
Yeah, he did a great job. Anyway, long story short, there are certain structures that are painful, certain structures that are not. This disc right here, L5-S1, if you look at the MRI, most surgeons, like I said, most doctors would say it's not a problem, but it was a problem. You can see the blue stuff right there. That is herniation. Here's more herniation. So it didn't look bad on the MRI, but it certainly was damaged. It certainly was herniated. It certainly was inflamed. It certainly is causing his pain. So most doctors would just ignore it, leave it alone, and the patient would still have pain after surgery at L4-5. Thank God we picked up on it at Deuk Spine. That's what separates us from everybody else, is we identify the source of pain, all the sources of pain. You guys saw the 30 different causes of back pain. We're able to diagnose all 30 at Deuk Spine. You will not find that diagnostic ability anywhere else in the world because we're the first in the world to do it. When I was in training, we were taught as neurosurgeons, as pain doctors, there is no source of back pain. It's what was called non-specific pain, meaning there was no specific cause. That's because they didn't know the cause, but now we do know the cause at Deuk Spine Institute. We're the ones who discovered the causes. And that's what that 30 causes of back pain video is all about. Any questions from the audience?
No current questions, but we do have a comment coming from Lord Impaler on YouTube
Sure.
saying, "Man, I can't wait."
All right. Thank you for your comment. I appreciate it. All right, Henry, let's show the audience how we treat painful disc injuries like this one we're treating right now. I think we're a little overexposed. Let's turn down the light one notch.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Well, folks, we're working here at L5-S1. You can see the pink right there. That's granulation tissue from chronic inflammation. That is where the pain fibers are. And we're going to continue to remove this herniation right out of the tear. If you have questions, feel free to type them up. I'll do my best to answer for you. The laser fiber, the glass is about 1 millimeter wide, 1 millimeter. There's the tear right there, and there's some more inflammatory tissue.
We can see. And we got no current questions, but we do have 2 comments. Next one from Lord Impaler once more on YouTube, saying, "I spoke with you last month. I believe I'm just waiting on my neck to be put back on the case because it's workers' comp."
Ah. Well, I pray that you get down here so we can help fix you. I just saw a workers' comp patient about a week ago. I can't give you names, obviously, but I'm going to tell you this patient injured his neck 15 years ago, and he had a different surgeon operate. He had a laminectomy, cervical laminectomy, but they did not fuse his spine, and they should have. So over the last 10 years, his spine has literally kinked forward, and now his chin is resting on his chest. He cannot pick his head up. He cannot pick his head up. He's looking at his feet constantly, and he cannot lift his head up. It hurts too much. So I'm going to possibly be doing his surgery within the next month. If you're interested in watching, it's going to be a very challenging surgery. I'm not going to lie to you. It's probably going to be one of the hardest ones I do in our center. I'm going to have to fuse him from C2 to T2 with screws and rods. reconstruct, and fuse. Wow, this L5-S1 disc is far worse than it looked like on the MRI. It's amazing. The MRI is just not good at telling you where injuries are. It's a good thing I picked up on this thing, because this is definitely badly injured. It's surprising how much scar tissue is here. Well, we're going to be probably operating on him because the other surgeon did not instrument and fuse him when they should have. I never do a cervical laminectomy without fusion. I talk to patients, I give them the option, but I tell them strongly recommend the fusion aspect, because otherwise you'll develop that chin on chest deformity after the surgery. All right, just about finished here at L5-S1. And I'm going to move on to L4-5 next. L4-5 is more degenerated, more collapsed than the L5-S1. Any other questions?
No current questions, but we do have a comment coming from Lanu on YouTube
Hello, Lanu. Welcome.
saying, sometimes I watch this while eating popcorn with soda. I feel guilty treating it like a movie theater. I wonder if any viewers felt that way.
That's funny, Lanu. Well, it's not a bad movie to watch, is it? You must be an expert, Lanu. You could probably do these surgeries yourself in Indonesia. You've watched so many of them. If I put you in a sterile gown with a laser in your hand, I'm sure you'd know exactly what to do. All right, we're just about done with this herniation. I've debrided the tear. This will heal beautifully. He'll be able to preserve normal movement and have a normal life once he's healed up from this surgery. Just about done. I don't think this is our first patient from Ecuador. I think we've had a couple from Ecuador. But we don't have a lot of patients from Ecuador. So he's one of the few from Ecuador. All right, that looks really good. Let me just take one last peek. There's some epidural fat right outside the disc. I may get a little bit more here, just a little bit more of this bulge that I want to debulk. And when you're removing a herniated disc, you're basically doing what's called a debulking. I need to get to 12 o'clock. You're basically debulking, like we debulk any kind of tumor or swelling or mass. You're removing it a little bit at a time, piecemeal. And here I use an endoscope to do that. All right, I'm pretty happy with that. I feel we got all the pressure off the nerves. I'm happy with that. Now that tear right there, remember the inside of this tube is about a little bit more than 5 millimeters. So that tear is probably 2 or 3 millimeters. That's going to heal very quickly, very nicely, now that we got rid of the herniation.
We have a question coming from Lanu once more on YouTube,
Sure, Lanu.
saying a lot of scar tissues on L5 to S1. Why doesn't the MRI pick it up?
Yeah, that's a great question. It's a very good question. I'll tell you why. Because the MRI, basically the annulus fibrosus, okay, the annulus, which is where the scar tissue is. The annulus is made out of collagen and elastin, and scar tissue is made out of collagen and elastin. So the MRI cannot distinguish one from another, scar tissue versus annulus. So it looks the same on an MRI. But I could tell because there was a bulge, B-U-L-G-E, bulging of the annulus. The annulus was bulging. So I knew there was a damage to that annulus. And the patient's pain was exactly where that L5-S1 and L4-5 discs were. So I had a high index of suspicion that he was symptomatic at 5-1. All right, we're going to go on to the next disc, which is L4-5. I'm very happy with the results at 5-1. Can you move the fluoro towards us a little bit? Shot. Yep. think that'll give me a little bit more working room. At Deuk Spine Institute, we have literally the most advanced fluoroscopes in the world, the most advanced operating tables, endoscopes. Everything we have is the best of the best. I spare no expense for my patients. I want them to have the best results, and like anything in life, you get out what you put in. If you put the best in, you get the best out. If you cut corners, then you're going to have not great results. So we don't cut any corners. We have the best of everything here, even from an anesthesia standpoint. Rock, Dr. Byrne does? Yeah, so. All right, we're off on WAG a little bit. Let's straighten up the WAG. Let me know when you're ready. It's a little better. You can see the pedicles are not lined up perfectly, but go ahead, shot. You're still off on WAG and not orbit. That's good. That's perfect. You can see the tip of the dilator is right there. You guys ready? We're going to advance the dilator into L4-5. There's a big tear at 4-5. This disc has been damaged longer than the L5-S1. Shot? Any questions?
At this moment, no current questions.
So we're going to go debride this tear. That will allow the tear to heal. Yeah, the problem, and this patient will understand it, is when you get all this inflammatory tissue and foreign body material in a wound, it will not heal on its own. It requires the surgeon to go in and debride, get rid of the nucleus pulposus that's stuck in the annular tear, shouldn't be there. That's a foreign body. Get rid of it with a laser, get rid of the granulation tissue, get rid of the scar tissue, the calcification, the inflammatory tissue, get rid of all that stuff in there, and just let the wall of the disc heal naturally. And that's what will happen in time. Takes about a year to fully heal. We tell everybody to be careful for the first year. All right, here we are in L4-5, laser. All right, 10 minutes. Berndes, 10 minutes, Berndes. Any questions?
At this moment, no current questions.
How's the piriformis looking good? Yeah. What's the question?
No current questions.
No, not you. I'm talking to Nikki. Oh. All right, folks. Here we are at 4-5. We're going to do our debridement. So far, everything's going great. He's lost maybe 1 cc of blood for the whole surgery to fix 2 discs and the piriformis. Blood pressure is good. Yeah, it's perfect. Couldn't be better. All right, you guys have about 10 minutes and then we're going to be done. So if you have questions, ask them now. We don't have surgery scheduled for Thursday, correct? So you know what that means? It's party time at Deuk Spine. My staff must love me. I give them a lot of days with just kind of time off, right? Hold it. But they deserve it. That they do. They deserve it. But Nikki, yes, before you go taking time away, you got to check with, you know who over there, Candy, okay? Right? In case she needs you. We have some new faces around here. They need some training. Right? And maybe you can come help out. Still get some early days, but help the company out a little too. All right. Any other questions for me?
At this moment, no current questions, but we did get a spike in viewership, so we'll see if anybody asks questions from that.
Why do we get a spike?
Because this is very entertaining and awesome.
Haha. Uh-huh.
Yeah.
I thought maybe you took your clothes off or something.
No, we haven't done Q&A in a while. Okay. Oh, we literally just got a question, though, coming from Lanu once more on YouTube, saying, just curious, how does his insurance from Ecuador is accepted?
Well, we don't take Ecuadorian insurance, so he's having to pay out of his pocket. But I'm going to tell you that he understands the value of good medicine. He understands the value of good medicine. You understand what I'm saying? In other words, it doesn't matter to him what the cost. What matters is the quality. And that should be on the forefront of everyone's mind as they assess their options for treatment of their back pain. Should I go with what the insurance covers, even though it's dangerous and doesn't work? Or should I go with what is the best treatment for my safety, my health, my well-being, the best results in the world, the fastest recovery in the world with the Deuk Spine Institute, even though they may not be covered? And he made the choice to pay out of pocket. So that's what he did. Not everybody makes the same choice, and I think that's a mistake, because I have seen far too many bad outcomes from spine surgery and other types of surgery, that if I had to have surgery on something on my body and the chance of bad results was high, I would want the best surgeon who has virtually perfect record, if that's possible. And that's what he chose. He chose me. We don't have complications. We never have had a surgical complication in 20 years of doing this surgery. Not a single surgical complication. There is no other surgery in the world that has no complication in surgery for 20 years. There is no such thing. It doesn't exist. No infection, no nerve damage, no CSF leak, no hematoma, no pneumonia. It's not really a surgical complication, but nonetheless. No nerve damage, I said. We have had recurrent disc herniation. That happens 1% of our patients get a reherniation. Again, that's not something that I control. It's something the patient controls. Patients have restrictions after the surgery. They can go back to work, but they cannot lift over 40 pounds the first year. They have to keep their lifting light. No contact sports the first year. So no jiu-jitsu, karate, boxing. Just take it easy the first year. You can still exercise. You can still go bike riding, hiking, jogging, all kinds of stuff. This is a much worse disc injury at L4-5 than the L5-S1. You can see much older type of herniations, looks like crab meat. But we're still going to fix this no matter what. He's not going to have any pain from this disc anymore. It will be gone. We've never had a failure, by the way. Never had a patient that we did this surgery on and their disc pain did not go away. Now, about 25% of our patients do have other sources of back pain besides the disc. So we'll go in and do the laser like we're doing now on a couple of discs, and then the patient calls us and says, hey, now I'm having pain in my buttock or my SI joint. And then we got to bring them back and they got to have another procedure done. But it's not ever because the disc pain didn't go away. The disc pain always goes away. It's always something different. Never had a failure. That's pretty incredible. That's a true testament to the fact that the disc is such a common cause of back pain, that once you fix it with this procedure, the pain goes away. By the way, for those of you who don't watch a lot of these surgeries, we're working in a tube that the inside of this tube is 5.5 millimeters. So to give you an idea, 5.5 millimeters, that's a 1/4 inch. So you're looking at a 1/4 inch. If you take your fingers and spread them apart a 1/4 inch, that's the tube that we're working in. Now it looks bigger because we're using a scope that's magnified the view, an endoscope, all right? But we're working in a very, very tiny space. So the laser fiber is very important because it's only 1 millimeter. That fiber right there is 1 millimeter wide. It looks big, but it's not big. All right, any questions? Because we're almost finished here.
No current questions, and we do have a comment coming from Lanu once more on YouTube saying this patient made a wise investment and took a leap of faith in you. A win-win situation.
Yep, I agree. Faith. But truly, I give people everything they need to make the right choice. We have 400 testimonials online, all video testimonials of real patients. And every one of them has paid for their surgery. And they do the testimonial because they're so happy that they came here and had this treatment to cure their back or neck pain. So we have testimonials, hundreds and hundreds of real patients. You won't find that anywhere else in the world. No other doctor has almost 500 testimonials of their patients that they've treated that are cured of pain, because it doesn't exist anywhere else. That's why. So it exists here, and we put it out there for people to see. So I give people good reason. Plus, we broadcast all of our surgeries live, so people can watch the surgery, and they can learn why we do this. They can ask questions. They can see how small the incision is. They can see the patients, the next day are back to being normal. So I think he basically, just being a scientist himself, he basically just did what every other scientist does, what every good scientist does. He just used the evidence, facts, to make his decision, right? He used scientific evidence to decide. There's an old saying, unfortunately it won't hold true much longer. Seeing is believing. I grew up in the 70s and 80s and 90s, and seeing was believing. If you saw something, you knew it was true because it was a video or a picture. Berndes, how's you doing? Good? Because I'm almost done. A little bit, but just check them. You happy with them? I got about 30 seconds left, actually. I'm pretty much done now. I'm done. Yep, we're done. Yeah, now you can't say seeing is believing because you got all that AI. All right, here's the epidural fat in the foramen. There's the tear, the annular tear. We've debrided it, and now look at that. It's about 2 to 3 millimeters. It'll heal very quickly. Lights on. Any other questions?
Yes, we have two questions. The first one coming from Christian on YouTube.
Hello, Christian.
Saying, hi, everybody. What is the probability that the pain will return in the future?
0. The pain never comes back with the Deuk laser disc repair. It's a permanent fix. There is no return of the pain. The only chance it's going to come back is if he reherniates, and that chance is 1%. 1% of our patients. We've done now 2,650 patients, and in those 2,650 patients, we've had about 22 reherniations. 22 reherniations. So that's less than 1%, but lately we've had a pretty good run with no reherniation. Why? Because patients listen to our advice. We tell them, hey, no lifting over 40 pounds, no contact sports, and no bending over at the waist for the first 6 weeks. And they listen, okay? And when you listen to the doctor, it's amazing things. You don't injure yourself. So just because you're feeling good, your pain's gone the next day, doesn't mean your disc is healed. That hole has to heal. So he has to pay attention and not do anything bad. Look how small that is, guys. Look how tiny this thing is. Okay? I fixed 2 discs with a about an 8mm incision. And then we did the piriformis earlier, and that feels good. I don't feel any hematoma. Thanks for joining us. Any other questions?
One more question from Lanu, once more on YouTube, asking, do you issue a receipt for the surgery? I think he can get a take a deduction when he's filing taxes in Ecuador.
Yes, yeah, we do issue a receipt. Of course, we have a computer system that keeps track of every transaction, so we can give him a copy of his invoice and everything. We do that for anybody who wants it. Well, thanks for joining us, and we'll be back next week on Tuesday. I'm Dr. Deuk Machen, CEO and founder of the Deuk Spine Institute. I have a patient with me who just had the Deuk laser disc repair less than 24 hours ago, about 12 hours ago. And here you are. How do you feel today?
I feel better than I have in probably half a year, I'd say close to 5 or 6 months. It's one day after and time will tell, but I didn't think this was possible this quickly.
Yeah, time will tell. We've done now 2,200 of these surgeries with the laser endoscopic. Consistently, the pain is gone. It's permanently gone. It never comes back. And so I'm excited for you that you're gonna do fantastic. Now, you live about an hour away. How did you find out about Deuk Spine Institute?
I got a referral and noticed that it was only an hour away, so made my way up here, and the first time I came for a visit was kind of felt like home, kind of felt like where I should be anyway, so that kind of fit right into everything this far. So
you had, was it back and leg pain, correct?
Back pain a little bit, but my biggest issue was shooting down the leg pain. It was numb all the time for about 4 or 5 months on and off, so didn't know what else to do, and this was the right choice, I would say.
You came to us and we found weakness also. You had weak pulling your toe up. That's because the nerve was pinched so bad at L5-S1. You can see here on the video, we went in with a tiny Band-Aid incision, 1/4 inch. We went in and basically removed most of the herniation, cleaned up the tear where it came out of so that the tear will now heal. Your disc will heal naturally. And we did it all without removing bones or ligaments. If you had had a microdiscectomy or laminectomy, which is what every other surgeon offers, because they don't know how to do the endoscopic surgery, it's a newer technology, then you would have had a bigger incision, you'd be in a lot more pain today, and you'd have bone and ligaments taken out of your back. It would weaken your spine, which would set you up for fusion. But with our surgery, there is no need for any future treatment on the disc. It's permanently fixed. Now, are you taking any pain meds today?
I haven't yet today, and I haven't felt the need to, which was another surprise I had too.
Yeah,
so
no pain meds, right?
Nothing.
No bleeding, no hospital, no pain meds.
Nope, in and out pretty quick. It worked out pretty well.
Pretty happy?
I am.
And you were referred through Coral, right?
Correct.
Coral Network.
Coral Network.
What do you have to say to the Coral people who approved your surgery?
I just appreciate the approval and the opportunity to live like normal and be a normal human again.
Yeah, Coral did you well. I guess they somehow got you to us and you avoided having an invasive surgery that was going to hurt you more than help you.
Correct.
Congratulations.
Yeah, well, thank you, Doc.
Anything else you want to say to your fans out there in YouTube land?
I would just encourage you to look into Deuk Spinal and figure it out if that's the right fit for you, and it was for me, absolutely. So, thank you.
You're welcome, my friend.
Appreciate
Congratulations.
it.
Take care.
You too.